Hi, my name's Stephanie Perez. I'm a nurse practitioner. I'm going to be taking care of you. Can you tell me your initials?
JQ.
Great. And is English your best language, or do you prefer a different language?
English, please.
Okay. And then your date of birth, please?
July 4th, 1987.
That makes you about
34.
34 years old. What gender do you prefer to associate with?
Male.
Male. And your race?
White.
Are you married, single, divorced?
Single.
And your ethnicity?
Latino.
What is your highest level of education?
College.
Which college did you go to?
Miami-Dade.
Miami-Dade? Me too.
Yeah.
What year did you graduate?
2012.
I'm old. I'm way before you.
No.
Where do you work?
I work for Amazon. I'm a driver now.
You must come to my place a lot.
Probably.
I'm always ordering from there, but it's so easy. Do you work daytime or nighttime?
Now daytime. I started close to a year ago. Nighttime in the warehouse, but I've been daytime since I've been a driver.
A driver.
Yeah.
Okay, great. And you do full time?
Yeah.
That's about what, 40 hours a week?
I'm doing more than that. I'm doing
gosh.
right around like 48, close to 50.
Wow, I'm so sorry. That's awful. Do you have a health insurance provided?
Yeah.
Okay,
Through the company.
great. So what brought you in today?
Like 6 months ago, like 8 months ago actually, I was having some like stomach like issues, just like uncomfortable, bloated, gassy,
Wow.
and yeah, I went to like an urgent care, and it was just real uncomfortable. And I've been dealing with that like
Bloated and gassy, and then an urgent care recently?
that was like 6 months ago. 8 months ago, I would say like
The pain started.
the discomfort, yeah, and then like pain would like every once in a while,
Okay.
but not consistent, just uncomfortable and discomfort.
Okay. We'll definitely get more into that. At the urgent care, I'm sorry, did they give you a diagnosis?
They said gastritis
Gastritis?
after they did a scan. I have the scan in the email. I don't remember exactly which one it was, but
Okay.
I can send it to you guys.
So, about 8 months ago, the pain started, and you get bloated, gassy, and discomfort.
Yeah.
Is there a certain region?
Like the top left part of here, like the abdomen. So
Okay,
top left. Yeah.
All right. Is there anything that you notice that makes it better or worse? Maybe when you eat or don't eat, any position?
Bread makes it worse, I've noticed.
Okay.
But no, better, I really haven't
It
noticed.
just comes and goes throughout the
Yeah.
day, and nothing really makes it happen suddenly. It just throughout the
No.
day you get these pains.
Just randomly, yeah.
Okay. Let me see. Sorry you're dealing with that. Is there anything
Thank you.
you can tell me about other illnesses you've had in your past? Any surgeries I need to be aware of?
I had a hip surgery. I was in a car accident.
How long ago was that?
Almost 20 years ago. I was in
wow.
high school.
You were young.
Yeah,
High school.
yeah.
What injuries did you have from that?
Broke my left arm, and just the hip.
And the
hip
hip
surgery.
You have hip surgery. Oh,
Not a
wow.
replacement or anything. Just
Is that the only hospitalization you had?
I was in COVID. I was in for COVID in 2020.
COVID. So you got admitted into the hospital?
Yeah, but like I wasn't overnight, so I don't know if that counts or not. But
Okay. What kind of symptoms do you have from COVID?
like tired. I had a fever. That's why I went in. I was just tired, congested, headache, and,
Okay.
but I didn't lose
Sense
smell.
of smell
No,
or anything? No shortness of breath?
No.
Okay. So those have been your 2 hospitalizations.
Yeah.
And then your injuries were the broken arm and the hip surgery.
Yeah.
And nothing else? No other disabilities?
No.
Okay. Any other injuries I need to be aware of? Childhood illnesses?
Seasonal allergies. That's it.
Okay. Sorry, I'm writing everything down. Are you up to date on your immunizations, your vaccines?
I have my flu. I haven't gotten my COVID vaccine yet, but I'm up to date with the flu.
Okay. Perfect. And then you said allergies are seasonal, but do you have any other allergies to medications or food?
Penicillin and shellfish.
Okay. Medications. Are you taking any medications currently?
No.
No. Any even vitamins? Anything over the counter? Anything for pain? Any supplements you might take?
No. No.
Okay. And then you said that you had your imaging from the urgent care. Is there any other imaging I need to be aware of that you've done recently?
No, not yet. They wanted me to get a endoscopy or something.
See a specialist?
Yeah, probably. Well, they wanted for me to see a gastro and my primary care. So.
Okay.
But no imaging. I've only gotten from that urgent care that one time.
Okay. All right. Perfect. Can you tell me about your family history? Anything I need to be aware of? Are both parents alive and well?
Yeah, both alive.
And your grandparents are both alive and well?
Yeah, both sets. I still got them.
Do you have any siblings?
No.
No. Do you have a spouse? Do you have any children?
No.
Okay. Any health conditions in your family now you need to be aware of? I'm sorry, like diabetes in the family, any heart failure?
Diabetes. My mom's side, her parents.
Okay.
Dad's side, no.
No. So as far as your stomach issues, and we definitely have to get into your nutrition. So how do you eat?
Not that healthy.
Not healthy?
No.
What would you consider not healthy?
Like fast food.
So you eat fast food?
Yeah.
Often?
Yeah, since I work on the road and stuff.
And you work 40-something hours a week?
Yeah, so I mean, it's unfortunately the quickest and the most affordable thing. So a lot of fast food. I'll have a soda.
Definitely bread.
Yes, with burgers. I do try to, sometimes I'll take one of the breads off or something. So.
Okay.
Try to do the best that I can, but I know I need to do better in that. I do drink a lot of water though, since I'm running around and stuff on and off the truck, so sweating a lot too. So I am drinking water at least.
Okay, great. So that brings me to the next question about how you go to the bathroom. Do you have any difficulties there? Do you have any pain? Have you noticed any difference?
No.
Blood, is it darker than usual?
No.
Consistency-wise?
Yeah, normal.
Normal?
Yeah.
Do you ever get constipated?
No.
No.
Bloated, but not constipated. Just bloated, and then, like I said, like gassy and stuff. But.
Okay. So you're currently working at Amazon. Do you live home alone? Do you live with anyone?
I have a roommate.
Roommate. Okay. Any animals in the house?
Yeah, 2 dogs.
Okay. And then would you say that you use any assistive devices to help you with anything, with walking, with functioning at home in any way? You don't
like canes and stuff.
Canes, walkers.
No.
Okay. And then going back to your family, do you have a good support system? You would say.
Yeah.
Yeah.
I still got everyone, and everyone's still good. So.
And then you're sleeping okay. Your rest patterns.
Oh yeah.
Getting good sleep.
I sleep anywhere.
Okay. And then how do you exercise? Do you get to exercise at any point?
Honestly, just work. It's a very
Sure.
active job, so I'm working like 6 days on average, and it's just running back and forth, and that's really my cardio.
Yeah, so you have no hobbies at the time, no?
Not really.
Okay.
Not really.
Right. Do you use tobacco, alcohol, any other substance I need to know about?
Social drinking, just whenever, maybe after work, a glass of wine or a whiskey or something, and every once in a while I'll have a cigarette, but nothing on the regular.
Okay, there's no patterns?
No.
Do you finish like a box of cigarettes in a week?
No, not even that.
Okay.
Not even that.
Okay. Sorry. And so how do you cope with stress since you work so much? Do you ever feel moments that you feel tense in certain ways or uncontrolled, or do you have no hope?
No.
Are you sexually active at the moment?
No.
No. Okay. Just to get a general aspect of everything. Any weakness, fatigue, fevers recently?
No, not recent.
Okay.
Last time was with COVID, but no, not recent.
Any excessive weight gain or weight loss recently?
When I started the job, but it was because I was exercising so much at the job, but no, it's been stable.
Okay. For your skin, any rash, lumps,
No.
sores, itching, dryness?
No.
No. Any patches of hair different, missing, more?
No.
Anything like that? Your headaches recently?
No.
Uncontrollable? Any head injuries? Dizziness, vertigo?
No.
Eyes, so any redness, any loss of vision, blurriness, double
Eyes?
vision?
No.
You wear corrective lenses?
I wear glasses to read.
Reading glasses?
Yeah.
Okay. Do you happen to have your prescription from a last exam?
Not on me.
When was your last exam?
Last summer? Yeah, summer 2021. I can get it to you guys though. I can send it with the other stuff.
Okay, perfect. Ears, do you have any infections recently? Any discharge that you've noticed in your ears?
No.
Your nose the same. Any discharge or different dryness, redness, anything unusual?
No.
And you didn't lose your smell from COVID, right?
No.
Okay. Colds
or taste either, so.
Colds or congestion lately?
No.
Obstructions or anything like that? Okay. No hearing loss, you said, right?
No.
Okay. For your throat, any pain, any toothaches, when was the last time you went to the dentist?
This year, at the beginning of the year, right in January, regular cleaning.
No dentures, right?
No.
Okay. Sores or anything like that? Any hoarseness in your throat? Okay. Any history of tonsillectomy?
No.
Okay. For your neck, any lumps or enlarged nodes? Any painful areas?
No.
And your chest, anything unusual? Any painful areas? Any chest pain?
No.
And your armpits too, sorry. And then working your way down to your torso.
No.
I know that you're having discomfort in your stomach, but on palpation or anything like that, have you noticed any discomfort?
No.
Any positions that change anything?
If I am leaning back in the bed for a long time or on the couch, I'll feel that area that I told you, the upper left. I'll kind of feel like pressure or maybe even like acid buildup. I don't know, honestly, but I'll feel something there.
That's very close to your heart. Do you feel any like chest palpitations?
No.
Shortness of breath?
No, luckily.
No trouble breathing, anything
No.
like that? Okay. And nothing that numbness or tingling in your arms?
No.
Okay. For your appetite, have you lost appetite lately? Have you had any nausea or vomiting?
No.
Okay. For when you urinate, you said you drink a lot of water. Are you urinating often too? Any trouble or discomfort?
No.
Bleeding? Anything
No.
unusual?
No.
Smells even? Colors? Nothing like that?
No.
Okay.
Clear or normal yellow, like.
And the skin is clear, no
Yeah.
sores or anything like that?
Mhm.
Okay. Let's see. For your legs, have you noticed any different coldness or tingling in your feet?
Coldness?
Like, are your feet more cold than usual?
No.
Tingling, color changes in your legs and feet?
No.
Okay. Muscles, any stiffness, any pain anywhere unusual in certain areas?
No.
You function fine. You can extend your arms and legs just fine.
Yeah.
Okay. For neuro-wise, any syncope, which is like dizziness, loss of consciousness, seizures,
No.
nothing like that. Involuntary movements, hallucinations. I'm sorry, mental disorders I need to be aware of. Okay. We talked about the any bruising. I'm sorry, we didn't talk about that. Any bruising or bleeding?
No.
Unusual in your legs when. We talked about cold intolerance, heat intolerance, excessive sweating.
No. Regular sweating, honestly. Regular exercise sweating, regular work sweating.
Okay, great. And no changes in memory?
No.
No. Any nervousness more than usual, anxiety or sadness more than usual?
No.
Everything dysfunction?
Stable, whatever.
Great. Okay.